stomach ulcer, also called peptic ulcer. A sore that develops on the lining of the esophagus, stomach or small intestine. Ulcers occur when stomach acid damages the lining of the digestive tract. Common causes include the bacterium H. pylori and anti-inflammatory pain relievers including aspirin. Upper abdominal pain is a common symptom. Treatment usually includes medication to decrease stomach acid production. If a bacteria is the cause, antibiotics may be needed. Early symptoms of stomach ulcers. Since the symptoms of gastric ulcers are very similar to the symptoms of a majority of digestive ailments, there's often a delay in treatment, which in turn causes the person's condition to deteriorate further. Thus, having a basic understanding of the causes and symptoms of stomach ulcers will help to rule out a misdiagnosis and the subsequent delay in the treatment. If the symptoms are diagnosed early, this condition can be cured within a short span of time. On the contrary, turning a blind eye to the early symptoms can worsen the situation, and cause a lot of pain and discomfort to the individual. An affected individual is likely to experience the following symptoms: dull, aching pain, burning sensation, bloating, belching, sudden loss of appetite, nausea, vomiting, fatigue, weakness, sour taste in the mouth, heartburn, weight loss. The burning sensation and pain that the affected individual experiences usually occurs right after a meal. The duration for which the pain is felt could range from minutes to hours. Complications. At times, symptoms of a serious nature may start surfacing in the later stages due to the extensive damage caused to the stomach lining. These symptoms include excruciating pain in the stomach, vomiting blood of a dark brown color, blood in stool. These symptoms could be a sign of complications such as bleeding, perforation, or obstruction of the contents of the stomach by the ulcer. Medical assistance must be sought as soon as the aforementioned symptoms begin to appear. Even at this point of time, the symptoms can be alleviated, provided medical help is sought immediately. The following tests are usually conducted to diagnose this condition: barium swallow, upper endoscopy, gastric tissue biopsy, gastrin test, C14 breath test. Risk factors. Those who have a family history of stomach ulcers are definitely susceptible, but there are other factors that may put a person at a risk for developing this condition. The risk factors include smoking, excessive consumption of alcohol, prolonged use of NSAIDs or corticosteroids, poor dietary habits, liver, kidney or lung problems. Treatment. Antibiotics are prescribed when the ulcers form due to an infection by Helicobacter pylori. The dosage will vary, depending on the severity of the infection. At the same time, the doctor will also prescribe medication to reduce the production of stomach acid so as to ensure speedy recovery. Proton pump inhibitors and histamine 2 blockers refers to the class of drugs that decrease the production of stomach acid. Sucralfate refers to a cytoprotective agent that forms a barrier or coating over the ulcer, thereby speeding up the healing process. Treatment will continue for 2 to 3 weeks. However, it will take a couple of months for the person to get cured completely. In severe cases, when there's bleeding or perforation in the stomach wall, surgery may be recommended. Precautionary measures. Avoid smoking and consumption of alcohol. Do not take aspirin or other non-steroidal anti-inflammatory drugs. Refrain from consuming spicy food. Many people believe that stomach ulcers are caused as a result of eating spicy food, which is not at all true. Spicy food can aggravate an already existing ulcer though. Helicobacter pylori bacteria could spread due to consumption of contaminated food and water, so take the necessary precautionary measures. Don't resort to self-medication. If you opt for a wrong drug, you will just end up worsening your condition. While antacids are effective in providing relief from pain by raising the level of pH in the stomach, you need to understand that this relief is temporary. So, don't take antacids unless recommended by a doctor. Do contact your doctor if you have been experiencing any of the aforementioned symptoms. Follow the guidelines regarding the frequency and dosage of the drug. This will surely pave the way for a speedy recovery.